Okay, I think you have lost connection. Okay, use the slides. These are some things that are there. Now, let's look at something from isolation wards. Now, what was the experience you had with COVID initially when COVID outbreak of COVID was there? How did we manage the biomedical waste? Anybody? Anybody who has an idea? Who I mean, we all went through this COVID outbreak, right? What did we do initially in the first wave? Come on, somebody has to tell. Yes. What did we do in the first wave?
Ma'am, double layering is recommended that
Double
time.
layering is recommended. First wave, initially, when it started, what did we do? We simply put all the waste from the isolation ward into the yellow bin and sent it across.
Yes, ma'am, after labeling.
No, after labeling it as COVID waste, and then they just put it into the yellow bin and saw to it that everything was incinerated. Right? It defeated the whole purpose of us having the waste and separate bins, separate color coded bins, and everything. So after, I think at the end of somewhere in the middle, they again issued a guideline stating what should be put into yellow, what should be put into red, and what should be put into white, and the needles. Many a times, half the waste would be made up of food waste. Okay, it would be food waste that used to consider. So they separated this general waste from COVID waste. COVID, I mean, all the PPEs, all the PPEs used to go into the yellow. Then, except for the face shields and gloves, which went into red. The rest of the PPE would go into the yellow bin. Right? So we came in with separate rules for it, guidelines for it as to how we go about doing it. Now, when you look at COVID, the mode of transmission was slightly different. Suppose if you look at Nipah virus, or if you look at Ebola virus, where the transmission is through blood and body fluids, the healthcare people are highly susceptible for contracting that particular disease because they are in touch with the blood and body fluids in the hospital. So, usually, in such kind of outbreaks where it is highly contagious or highly infectious, WHO generally gives certain guidelines. Whether even if the general guidelines is if it is highly infectious, we tend to incinerate most of the waste that is generated from those particular wards. This could be PPE, what we wear, because we need to wear PPE if we come into highly infectious cases. There are chances that we may get infected from it. But there is one problem here. The hospitals are not equipped to incinerate any of such kind of waste there itself. We run the risk of transmission of the disease when we are transporting these kind of waste to the common treatment facility. So we need to have a mechanism there. Even before sending it to the common treatment facility, as minimum handling as possible is what we need to look at. We need to look at first on-site disinfection and final disposal being incineration. Why are we doing this on-site disinfection? Either it could be an autoclave or a chemical disinfection, depending on the disease and depending on what the guidelines tells us either the guidelines can come from WHO or it can come from Ministry of Health and Family Welfare. Okay, am I clear here? In COVID, we did get guidelines. They said this is how you need to discard. They said everywhere it has to be double layered. It has to have a bold sticker or labeling it as COVID-19 waste. Even today, if you have any patient with HIV or hepatitis B, especially HIV, what do? Most of the waste that is generated out of this HIV patient are generally segregated. Either they are autoclaved. One advantage of HIV is that the virus cannot survive in the environment. So the moment it is out of the body and it is out in the environment, invariably the virus dies. The chances are very less that it can be transmitted to another person through this kind of waste, except in a needle stick injury. Why we are specific about needle stick injury is that in the needle is hollow. Sometimes there could be some liquids that can be retained in this needle. So that would form a moisture or a closed environment where the virus can survive. So that is why we take needle stick injuries very seriously, and we always handle or tackle the needle stick injuries in a. We tend to give the what is it? Prophylaxis earlier itself within 72 hours of exposure. So on-site disinfection is necessary for such kind of, I won't say HIV, but I would say any other uh, diseases which have high propensity to spread, like either Ebola virus or Nipah virus or any other hemorrhagic viruses that can spread very quickly, and where the mode of spread is maybe through blood and body fluids. So your PPE, what you wear, is of utmost importance. Donning and doffing of the PPE would become important. And you need to autoclave it before you send it to the common treatment facility. The reason is that en route it should not infect anybody. That is the basic idea. Okay, sometimes it is necessary that you do not want to send any such waste outside the hospital. You can allow a small incinerator to be instituted in the hospital if such a situation arises. But generally, it is not, and that will only be temporary as long as that outbreak is there. Otherwise, it with the same rules holds good. For that, again, the guidelines has to come from CPCB. It could be a small single unit incinerator is banned actually, but in case of certain special situations, there are chances that they might give you the permission to use it so as to reduce the impact of infection to other people and as well as to general public and the people who are handling waste. Okay, so Ebola on-site treatment is by autoclaving or incineration ash is to be buried in the deep pit. Okay, now let's look at blood bags or blood banks. What sort of waste is generally generated in any blood banks? Yes, I need somebody to answer. What sort of waste is generated in a blood bank?
Ma'am, blood bags, uh,
Blood bags,
then gauze pieces, swabs, needles,
swabs, needles, yes,
vacuum tubings,
vacutainer, tubings,
ma'am,
s-
then
mm,
disinfectant or any reagents which are used for
which are
blood
used for
grouping.
blood grouping and typing. So for
Then,
us, blood banks actually come under the rules. But the specific thing here is the blood, and we treat blood to be highly infectious. Any body fluid, unless proved otherwise, is considered as infectious. So blood, there are chances, are very high chances that it can transmit the diseases. So therefore, you have to be very careful in discarding any infection, any material which is contaminated with blood or even body fluids for that matter. Blood bags are the major things that we get it. Any soiled waste, chemical waste, the blood samples which are remaining, laboratory waste, sharps, glassware, infected and disposal plastics. So, how do I basically discard the blood bags, irrespective whether it is empty, partially filled, or full, which is the expired blood is present? How do I do it? As per the rule, it says it has to go into the yellow bin. But before it goes into the yellow bin, it has to undergo pre-treatment before discarding into the yellow bin. What sort of pre-treatment is adopted for handling empty blood bags or black or blood bags with blood which is half filled or fully filled? That is expired blood. It could be, or it could be blood which is which has been found HIV positive or hepatitis B positive or anything of those things are there, then you discard that particular blood. You don't use that blood. So how do I discard it? What are my mechanisms of? Uh, is there a mechanism by which we can use this? Even in a hospital, how are the blood bags basically discarded or disposed? Yes,
Ma'am, blood bags to be disinfected or autoclaved first, and
mm.
then to be sent for incineration or
Incinerate.
landfill.
Landfill, right? How do I disinfect the blood bags if it is there is blood in it? Autoclave is a good idea, but if I
Okay.
have to disinfect, how do I disinfect it? Do I inject the disinfective agent inside the bag?
No, ma'am. We will soak in 1% sodium hypochlorite.
No, but then the disinfective agent has to get inside the blood bag, right?
Ma'am, we have to empty the blood bag.
Empty the blood bag and again see that it is disinfected, right? The blood is the one which is infectious agent here. Where are you going to empty it? And whoever is emptying it is exposed to a risk of contracting or getting in touch with the infective agent. So anybody who's handling blood will have to protect themselves with a PPE. Ideally speaking, the autoclave is the best method. Using of autoclavable safe bags, you put the blood bag whether full, empty, or partially full, or whatever it is. Once the blood undergoes autoclaving, it becomes a kind of a jelly like a thing, and it may be a more of a solidified material rather than a liquid material that is there. You pre-treat it either by autoclave and then you send it for uh, incineration. So the idea what I'm trying to say is, earlier we used to have these diagnostic labs and blood banks left, right, and center everywhere, anywhere. But as per the rules, if you look at it, you cannot set up even a diagnostic lab without having the facility of a waste autoclave. That means you should have an autoclave which is meant specifically for treating the waste. Autoclave is also used for disinfection and sterilizing your instruments or things like that. But then you cannot use the same autoclave to treat your waste or disinfect your waste. So therefore, you need to have a separate autoclave for waste alone. We call it as waste autoclave or autoclave, so that you disinfect the waste that is generated before you send it to the common treatment facility, and then you said put it into the yellow bin. Now, mortuaries are one more place where every hospital may not have a mortuary. Most of the medical colleges do have these hospitals where have mortuaries. Mortuaries are places where the dead bodies are stored, or they do a post-mortem that is generally done here. So what do you get in this mortuaries? You get human body parts, which again goes into yellow. Body secretions, whatever that are there, That may again lead it to any of the soaked cotton or gauze pieces go into the yellow bin. If you are using any sharp instruments to cut open the dead body, that again goes into the white. Usually it would be a scalpel blade or even heavier than that. Cotton, gauze, or any soiled waste goes into yellow. If you are using any embalming fluid where that is used for preserving the dead bodies, that goes, if there's extra that is left, it goes into the yellow. Chemical waste, which is again yellow. You have disinfective agents like formaldehyde and glutaraldehyde, which again goes into the yellow bin if it is expired or if it cannot be used further. Mortuaries are special places here, which usually you do not find it everywhere. In a hospital, every hospital will not have mortuary. So veterinary hospitals, here the difference is that the patients don't talk. They may bite or they may bark or they may do something else or they may scratch you. Unlike the human patients who talk a lot. So this the kind of waste that is generated are basically very similar to the hospital waste that is generated in the hospitals for human beings. Similarly, you will have sharps go into white. Any invasive procedures that they use that go into sharps when they use it, it goes into the white bin. Anything that is contaminated with blood or body fluids goes into the yellow as per the categories in the biomedical waste management rules. Cultures, they also use lot of antibiotics. They also use culture and do culture and sensitivity because the animals are also, pets are also more prone for infections. Vaccines are used for them, especially rabies, anti-rabies vaccine, which I am aware of. There might be other vaccines also. These vaccine vials, they are of the used vaccine vials goes into the blue category. That is the vials which do not have the vaccines. The vials where the vaccine is there, it is treated as pharmaceutical waste and put into the yellow bin. IV tubings and other recyclables go into the red. Body fluids, liquid waste goes into the ETP. And if they are using any other chemotherapeutic agent or iodine, lead, and silver, it is goes as the hazardous waste. This, in general, is the waste that is generated in a veterinary hospital. In the pharma industries, you basically might have biotechnological waste, microbiology waste, animal anatomical waste, all these waste as per the rules of biomedical waste management rules. The same rules are applicable, and these are the same set of segregation and disinfection is applicable even in the pharmaceutical industry. But it is man, or I would suggest that it is better if all the pharmaceutical companies do have an effluent treatment plant rather than just a sewage treatment plant. And if there are any hazardous chemicals that are being used, that needs to be kept aside or marked and appropriately treated as per the instructions that are given, the material instructions that are given for those hazardous chemicals. Any chemicals that are supplied do have instructions as to how it needs to be disposed or how it needs to be discarded, what will be the final treatment procedures that need to be adopted, whether it is flammable. All this information are given in the material. They call it MSP or something. They call it, where the information about the material or the substance is definitely provided, and we need to follow those instructions. As per those instructions, we need to do it. Okay, so this is with regard to pharma industry. And these are the special locations, immunization camps. This is as similar to any injection center in our hospitals, but since it is there in a different locality other than the hospital, whenever an immunization camps are being held, the people doing the camps also require to carry with them facilities or materials that are required for them to do the segregation. So, what sort of waste is generated in immunization camps? Somebody elaborate. If you have to get your child immunized, what sort of waste is generated? Think.
Ma'am, use syringes or needles.
Use the syringes or needles. Very good. Then use the syringes or needles. Where do you want to throw them? White
White
bin,
bin,
na?
ma'am. Then, ma'am,
So they have to carry white bin. Then
then, ma'am, red,
syringes, where do you throw them? Needles, you can throw it in the white bin. But what sort of syringes are used in
red bag.
immunization?
Ma'am, pre-filled.
Pre-filled or auto disabled. That means only once you can use it.
Yes, ma'am. Single
So they
use.
are fixed needles and syringes. You cannot separate the needles from the syringe. So they all, as in toto, it goes into the white bin. Then you have your cotton swabs that are used for cleaning. That goes into the yellow bin. The wrapper of the syringe again goes into the general waste.
Then
If
vials, ma'am. Vials and
vials go into the yellow.
not
Empty vials go into yellow.
empty vials.
Half filled, huh?
Vials will go in blue.
Blue. Yes, sorry. I'm sorry. Thank you for that. Empty vials go into blue. Half filled ones where you are used something and not use the rest of the thing. If there is an open vial policy, in the sense where you are allowed to reuse that vaccine, you can take it back to the hospital, store it, and reuse it. But generally, most of the vaccines, open vial policy for certain vaccines is not encouraged, especially measles and BCG, they are not encouraged. So after 4 hours, you need to discard the vaccine if there are no takers or if there are no children for you to vaccinate. So those things will go into yellow one. Okay, so that is, and so essentially you need to carry the yellow one, you need to carry the red one. If you're using a gloves, the gloves will go there. Yellow bin because there are swabs that are used. White one because you're generating needles and syringes. If the needle can be separated from the syringe, fair enough. You will have syringes in the red bin and the needle in the white translucent bin. So this is what an immunization camp generates. What about the medical camp and surgery camps? It all depends on what sort of services are being provided. If there are any invasive procedures that are there, or if there are any places, say in a medical camp, if there is an OBGYN person who comes to examine the women, then you will have gloves which are generated. Then you can have swabs if she's taking pap smear. Those things would come, the spatula for pap smear and how to keep the smear, and these are some of the waste that is generated. If there is a OBGYN, if they are giving any injections, the injection waste is generated there. So it all depends on what sort of services are provided and what sort of intervention is provided in those camps. Based on that, you need to carry adequate material so that the waste that is generated in the camps is segregated at the camp itself. It's not like you put everything into one bin, you bring it back into the hospital and then try and segregate it. Worse, if they try to leave the waste there itself, that is the bad thing that should not happen with regard to medical camps or surgical camps, what they do. And in school health clinics or first aid centers, what is the kind of waste that is generated? First aid, it could be blood soaked swabs or gauges or something where you can have cuts or any injuries that happen to children. So these things that, or any body fluids in terms of vomiting or diarrhea, these are some of the things that are generated in any of the first aid centers or school health clinics. Now, in dental clinics also come under the biomedical waste management rules. One extra thing that you find other than these cotton gauze pieces or PPE, what is used is your amalgam, that is mercury. They use an amalgam to do the filling, especially in dental colleges. But in dental clinics, maybe the use of amalgam has reduced, but still There are places where amalgam, that is mercury amalgam, is used to do the dental filling. Whenever is mercury amalgam is used, there will be some amount of mercury that is there. So this has to be handled very carefully, and you are not allowed to discard mercury in water, because the moment it goes into the water, there is biomagnification that can happen, and it can lead to more hazardous consequences. That's why mercury should not be discarded into water. So, what should we do with mercury? Store it and reuse it for some other purpose is the only option what we have for mercury, because mercury is a element. You cannot destroy an element. You can only bring in a make a compound out of it which is less hazardous. So the next thing, what we have mostly of late, many of you are having a digital X-rays. That means you are not actually taking a film and then developing it and then having a look at it. But apart from digital X-rays, sometimes we still look at the film, right? So whenever we are looking at the film, the X-ray film is developed. So for that, a developer which is used, which is sodium silver nitrate and hypo are used. Therefore, there is whatever the developer fluid that is there or the liquid that is there has got silver in it. For that reason, these fixer and developer fluids are basically stored, auctioned to an authorized recycler, so that the recycler can use the same fluid to extract silver out of it. Okay, so most of the places digital apartment things are used now. Now radioactive waste are very less that is generated in otherwise places. Only in places where um, cancer treatment happens or radiotherapy is given, that is where radioactive waste is used. Any radioactive waste that is generated has to follow the rules set by Baba Atomic Research Center. Whatever BARC looks after its, which energy atomic energy act, based on that it needs to we need to discard or handle the waste, radioactive waste that is generated. The basic idea is radioactivity decays, and as long as the decay happens, half life of the decay you need to protect it. Generally lead is the one, they say the radioactivity does not pass lead, so they are stored, they are contained. That is what is generally done with any of the radioactive material. Sometimes if the radioactivity is very low, they can also send it through the water sewers or the public sewers. Now the most important thing that comes here is the home based waste. How do we handle the waste that is generated at a household level? It could be expired medicines. Maximum amount you get is the expired medicines, because you do not know, you may not utilize the medicines appropriately. Or there are times when you buy medicines and keep it but don't generally use it, and they get expired. That is when you need to discard them. Expired medicines are something which is the most common biomedical waste that is generated at a household level. Another most common thing that is generated are your needles and syringes, and your gauze and cotton, which is used for dressing minor wounds or cuts or any of the things that are there. So the same rules apply. What rules apply here is, as per the solid waste management rules of 2016, if any such waste are being generated at the household, the most common another thing that comes up in the household level is your sanitary napkins and um, diapers. It could be adult or it could be a child diaper. So how do I basically uh, manage these things so that it will not be affecting the person who's handling it? So the best way to do this is that you put everything into a newspaper, all the biomedical waste. It could be discarded medicines, it could be needles, it could be gauze pieces of cotton in a kind of a cardboard box, or even a newspaper, and put a red into mark on it, so that indicating to the waste handler or the collector of the municipal solid waste that this is hazardous waste, household hazardous waste, and they need to treat it carefully. This is what can be done at the household. Sometimes in certain places, uh, they all collaborate together. If it is a huge apartment complex, there are places where they would, just like how they segregate the municipal solid waste into wet waste and dry waste, similarly, biomedical waste is also a bin that is kept there, and they put all their waste into it. So that is also possible when it organized way, when it happens in a large apartment complexes or societies, but individual household level, it may not be as feasible as told here. Now, when it comes to emergencies and disaster, like for example, there is a flood, or there is an earthquake, or there is a landslide that happens, what happens in such kind of cases is, the first and the foremost thing is discarding or burial of dead bodies is one thing which is of utmost importance in such places. So you need to find a place where you can on-site burial. Pits or trenches are one options what we have, or any special municipal dumping sites if the government organizes or knows it. That is one option that we have. Burning whatever that is there and covering with soil. This is one thing, one option that we have, and everything depends on how the guidelines come for it. If there is any sharp waste or small quantities of pharmaceutical waste, you will have burial sites or incineration that happens. Disinfection of infectious and sharp waste with sodium hypochlorite, or non-sharp waste disinfection should join the uh, general waste. There could be an autoclaving and then go ahead for general waste discarded. So this is one of the options that we have. Why is it important for us to look at emergencies and disaster? Is that you are overwhelmed with a lot of other things that is happening. Waste will be the least of your things on your mind, but it is important to have a mechanism of disposal of waste that is generated also. Otherwise, this waste again would become a nidus for infection or any other problem that could come in such situations. So one thing what we need to understand here is that mercury thermometers, there are places where it should not be burned. Anything which has mercury should not be burned. Pressurized containers, you cannot put it into the incinerator because it will just explode. Instead, would rather suggest the safest place is a burial pit. PVC plastics and vaccine vials, these are the things which should not be burnt. It should not go into the yellow bin. If we remember these things, then it is easier for us to see that you don't put things which should not be incinerated into the yellow bin. Just remember one dictum: anything that goes into the yellow bin goes in for incinerator. If you can remember that, we will know. That means you, before putting into the yellow bin, you think twice. Can this be incinerated or not? Based on that, you can decide. So for mercury, there is hazardous and other waste of 2016 that is there. And for e-waste also, you have e-waste management rules of 2016. Thank you. I'll stop sharing. I think this was more of a monologue from my side. Now I want you to ask any clarifications you have. Anything you would like to ask me? Any doubts you have? Yes?
Ma'am, if we discard biomedical waste at home in a single bin, it will not get mixed.
Yeah, it will. I get your point, but actually, whatever is generated at home You don't consider it as biomedical waste, though it is having hazardous nature. What you do is you have to give it to the waste collector. There is house to house collection of waste that happens for municipal solid waste, household waste. You need to give it to them stating specifically that this is biomedical waste by
Okay, ma'am.
putting an into X mark into it, and specifically you need to hand it over. The same case when it comes to an apartment complexes where it is organized, you can get the common treatment facility person to come roughly around once in a month or once in 15 days or once in a week, depending on the situation. They can come and collect it and go. They can have a liaison with the common treatment facility. It has happened in certain places in Bangalore. I think in other metro cities also the same system can come up.
Okay, thank you so much, ma'am.
Thank you. Any other clarifications? Any doubts anybody else has? This is an elective actually.
Urine bags contains the body fluids.
Mm.
So can we put it in yellow or in red?
Sir, actually urine bags has got body fluids, but you actually discard the urine in the sewage or the sewer, and then the urine bag is what is put into the red.
Okay, ma'am. Thank you.
See, the idea is to salvage most of the recyclable materials that are there.
Okay, ma'am.
So that is the idea, sir. Any other clarifications?
Uh, Ma'am, I have a single query. Ma'am,
Hmm.
if we have to treat a blood bag with chemical instead of
Hmm.
autoclaving it, though autoclaving is the best method, but
Hmm.
if we don't have any separate autoclaver and we have to treat it with chemical, then how and where should we first empty the blood?
Uh, $1 million question. Even I do not know, but provided the system has an ETP or a sewage treatment plant, at least should be there. Then you can discard it into the drain and then treat it.
Okay, ma'am. Thank you.
That is one thing suggestion, but I won't see that is the best way to do it.
Because blood is highly infectious, and whosoever the person is will be handling may get chance of infection.
Yeah, so you need to be careful. The best way is to autoclave it so that it remains. I mean, you are neutralizing the pathogenic agent, and then you are trying to handle it. Minimal amount of handling, the best it is. Even if you look at if there is blood already, discarded blood already in the blood bag, the disinfecting it is very difficult using a chemical disinfecting agent. It's not effective. You have to use equal amounts of at least 5% sodium hypochlorite because it's highly rich in organic matter. And when you use so much of it, your blood bag has a limited volume. How much extra can you add? You get my point?
Sorry, ma'am.
If I use a chemical disinfectant, I have to add equal amount of it, right? Say for example, in a half-liter milk packet, if I have to add another half liter of any other chemical substance or a liquid substance to it, will there be space for it? Is it possible for me to do it?
No, ma'am.
Not possible. So I need to disinfect it and remove it out of the bag, disinfect, and then send it across. That is the only option what I have.
Okay, ma'am. Thank
Thank you. Any other clarifications anybody has? If there is no clarification, I'll call it a day. And somebody has sent me. Oh, I'm sorry, I'm not looking at any of the uh, messages. because I can't see. Once I start sharing, I cannot see the screen at all. It's so difficult. Okay, if there's nothing, then I'll call it a day. Thank you.